Assessment and treatment of the shoulder joint should be done in the context of a sound knowledge of the functional anatomy of this area. It should be seen in terms of it being the shoulder complex, as there are a large number of joints and body areas involved in the movements that occur at this part of the upper limb. The joints that we need to think about include the sternoclavicular joint. Sternoclavicular joint is important in terms of it being the only bony articulation of the whole upper limb with the trunk. We've also got the acromioclavicular joint, which is the joint between the clavicle and the acromion of the scapula. We of course have the glenohumeral joint, which is the joint between the humeral head and the glenoid fossa of the scapula. And the scapulothoracic articulation, not a true joint, but a very important articulation in this area, which is the articulation between the scapula and the thoracic cage, the rib cage. This joint is unique in terms of it being controlled purely by muscles. In addition to being aware of the movements of the shoulder girdle, the joints of the shoulder girdle, it's important to remember the influence of the movements of the spine and positions of the spine on the movements of the shoulder. The posture and movement in the cervical spine and thoracic spine must also be assessed and considered, as any dysfunctions in these areas can have a large influence on how the shoulder girdle moves. As with all joints in the body, there is a balance between stability and mobility. In the shoulder joint, this balance is tipped towards mobility. The shoulder girdle provides a large range of motion to place the hand in space and allow us to do a large range of functional tasks. Because of this, our assessment and our treatment of the shoulder girdle very often takes into account this aspect of stability. We're often assessing to see how stable the joints are and treating to increase the stability of the joints here by working on the muscles that control them. In addition, the shoulder girdle also has a large range of mobility. Again, our assessment and treatment will be looking to see whether these joints are hypermobile or hypomobile, as this will also have a big influence on somebody's functional abilities in this area.